so we've talked about the midbrain. We all understand the midbrain. So let's talk about the cortex, right? So what's happening in the cortex? The cortex is where all of our skills are, right? We talked about that. So when I'm learning a skill, it's like walking through the woods, right? Creating a footpath through the woods. And the more I walk that path, the wider the road gets. So the more I practice a skill, the wider the road gets. And eventually, let's say I'm playing the guitar and I'm planning to go to Carnegie Hall. I have to practice, and I have to get that road wider and wider and wider, right? Eventually 16 lanes, traffic in both directions, that's Carnegie Hall ready to play the guitar, okay? When I'm done, I put down the guitar and I don't play again. All that happens is we hang up some police tape and we close the road. And we say, okay, this skill pathway is still here, but we're not using it. And so over time, the infrastructure gets weak, potholes develop, it's still there, but it's not usable, or it is, but it's not gonna be as efficient as it was, right? So 20 years later, you pick the guitar back up, you're gonna be much better at playing the guitar than somebody who's never played, right? Regardless, because you've got that 16 lane infrastructure. It just needs some work, some more practice, right? Skills are skills, and they all work the same way. So coping skills and the ability to cope with stress are skills, right? So we have to develop them in the same exact way. Now, for someone who started using substances as a child and never developed coping skills, they don't even have a footpath through the woods. Whereas someone who started using substances or having problems with substances later in life may have some paths to fall back on. So that will determine in part how we're going to treat these people. But essentially, coping skills have to be developed. Now, here's what happens when we pick up a substance that releases high-level dopamine in the midbrain. The brain goes, that is the coping skill. That's it. Nothing works better. Nothing works better than drugs to cope with life. And so police tape gets hung up over that skill section, right? Those roads get shut down. And so the brain will only ever reach for the high-level dopamine as a coping skill. So, which is another reason why I think many of the traditional programs, and certainly at IBH, we talk about abstinence-based treatment, aside from MAT, which I'll get to. But because the fear is that if we're constantly reaching for a substance, something with high-level dopamine, we're never going to properly develop those coping skills. And if we don't have those coping skills, then the chances of relapsing are obviously very high because life is very stressful.